Good evening and welcome to Soulibration. I'm your host, Shamika Rhymes. Let me know where you are watching from and how you're doing this evening. And remember to share this with your network. And if you have any questions at all tonight, please drop it in the chat because you guys are the co-hosts. I know I've thrown you all off because we're doing this on a Tuesday, but it's for a good reason. But because it's July 1st, and that also means July is Fibroid Awareness Month. So I wanted to kick this month off, like kick down the door talking about fibroids. So it's more than just a calendar event. It's actually a call to action. So tonight on Soulibration, we're going to be talking about what's actually working in fibroid care, especially for Black women who are often overlooked or pushed towards surgery without real options. And I have one of my favorite OB-GYN and women's health experts here tonight to help us unpack those symptoms. And you really shouldn't ignore them. So she's going to break all that down for us. Questions to ask your doctor, the importance of personalized care. And we'll also talk about an innovative and minimally invasive fibroid treatment that she's developed. It's a procedure. And we're also going to offer some hope to those of you that are maybe not interested in major surgery, but there's some other options that you can try. So if you've been dismissed, misdiagnosed, or like me, told many times, we'll just wait and see what happens, then this conversation is for you. So make sure, like I said, share this with your network. So let me introduce you to tonight's guest, Dr. Faith Ohuoba. She is an expert in women's health and the first Black OB-GYN and department chair at Memorial Hermann Northeast in Texas. She's a leader in holistic women's health. She specializes in maternal and child health, and she empowers women through her innovative approach to wellness and healing. And so she's also an author. I'm telling y'all, Dr. Faith is everything. She is the author of Peace RX, a simple strategy for holistic healing, where she explores the connection between faith, mindset, and wellness. So let's welcome Dr. Faith.
Shamika. And I'm very, very honored to be here, as well as just taking the time to talk about fibroid awareness on, the kickoff of the actual month. That's amazing. So kudos to you.
Yeah, thank you. And I think I even wrote this on my social media. This is personal. I mentioned before, I've had my own fibroids journey, and I have been very vocal from the beginning about the misdiagnosis, the mistreatment, all the things. So my journey started in 2013. So yes, this is personal.
And you know what? So many people have probably similar stories,
Mm-hmm.
but never have a platform to talk about it or even to express their successes. So I think this is a very important conversation to be had today.
Absolutely. So I guess we should start with the number one question, because I know some men are watching and they're always, I can't tell you, I think I was telling one man at some point along the journey I had fibroids, and he kept saying, "What's wrong with your thyroid?" I'm like, it's not my thyroid. So what are fibroids, and why does it seem to affect so many Black women?
That's a great question. So fibroids are benign tumorous growths. So when I describe them, a lot of OB-GYNs sometimes will describe them in terms of like fruits to
Mm-hmm.
describe the size, whether it's like a grapefruit, an orange. But the consistency of them tend to be like a cauliflower or a broccoli. So they're very firm unless they're starting to die off. But for the most part, they're not cancerous. However, there are cancerous fibroids. That is
Mm-hmm.
rare. In my career, I've probably seen it maybe 5 times, right? So the problem with fibroids is, given the location, the
Mm-hmm.
size, or how many you have, you'll have a different symptomatology. For one woman, infertility may be her main complaint. Another
Mm-hmm.
woman, it may be heavy bleeding. Another woman may be pelvic pain. Another person, all three, right?
Yeah.
And that's part of the ask for Fibroid Awareness Month, is that we really educate women about what their bodies.
Well, that brings me to the next question: is what symptoms are overlooked or dismissed by doctors? Because I know, and I'm sorry, y'all, I'm gonna be throwing in some of my own personal experiences, and because I'm sure you can relate. But when I was first diagnosed,
Mhm.
my period had completely stopped. But it was I just kept gaining weight. And when we finally did the ultrasound and all that, it was like my uterus was the size of someone that was 5 months pregnant, but there was fibroids everywhere. And
Mm.
so what other, so I didn't have the heavy bleeding that time, but the
Mm-hmm.
next couple times I was diagnosed, yes.
Mm-hmm.
So what
So
other symptoms
you make an excellent point. So one obviously is the heavy bleeding, right? And so
yeah.
with that, just at baseline, a lot of times a woman's menstrual cycle has been normalized. Oh, it's okay, it's heavy. Oh, it's okay if it's extremely painful, and it's actually
Hmm.
not. So in your situation, another symptom, we categorize it as like bulk symptoms, right? You can have
Yeah.
bloating. You
Yep.
can feel like your belly's getting bigger. So I usually tell people by the time your abdomen or your belly is about it's poking out, you have at least probably four fibroids or large ones.
Hmm.
And even if you don't have heavy bleeding, something, and I'm not sure if you experienced this, constipation,
Yes.
right? Problems with urination, right?
Hmm.
Because although you're not having heavy bleeding, the mass effect of that fibroid is pushing on all those
Hmm.
other organs. So those
Yeah.
are other things to look into.
Hmm.
Yeah.
Yeah, I'm just curious for those of you in the comments that have dealt with fibroids, what symptoms did you have? I mean, yes, I literally, mine, I don't know if anybody else had this issue, but I craved the most random things. Like there was like I stood in that store crying because they were out of Debbie cakes. Like, because I was so like just craving that. But the first time I was craving a specific ice cream and M&M. So every night I got off work, I was at Target because it was the only thing open at that time of night, buying that every night. So it was like, and then I had my fibroid surgery and the cravings went away. It's so
Mm.
so weird. Oh, I see someone said they were nauseous and it felt like acid reflux. They couldn't eat certain foods. Um, yeah, is that another symptom, acid reflux, or does it just depend on where that fibroid is sitting or fibroids are sitting?
So acid reflux isn't necessarily a common symptom of fibroids.
Hmm.
There could be other stuff going on.
Okay. So is there a typical age or stage of life when fibroids start to appear?
So the problem with fibroids is by the time a woman is 50 years old, 80% of women, especially Black women, might have fibroids, whether they know it or not. And
Hmm.
so during the reproductive years, you can develop fibroids. But what's even scarier is you can be in your 20s and have fibroids. And so what I've seen is I'll have patients come in who know, okay, mother, auntie, all these women in my family had fibroids. I'm 20
Hmm.
something and I want to know, am I
Yeah.
okay? Right?
Hmm.
So the issue is there's no strict guidelines to say, hey, at age 27, start doing the ultrasound for fibroids. Where
Hmm.
we have with breast ultrasounds, right? Breast mammograms,
Right.
right? At age,
Right.
35, doing your risk factors or 40, there's nothing like that exists. So that's why it's really important to know your family history, to get educated so you can unfortunately kind of advocate for yourself.
Hmm. Well, how did you diagnose fibroids? Now I'm acting like I don't know this, but how are fibroids diagnosed? And what tests are the most accurate? Because I know I've been through several different things.
Mhm.
And you guys also, again, let me know in the comments your experiences. Um, yeah, Dr. Bates, how do you diagnose that? Is it just during a typical pelvic exam and then it's once you feel it, then you go to the next step? How does that work?
It's all of it. It's all of it. So an ultrasound typically is the best way to take a look. And if you're up to date with your annual visits, your physician should be able to do an exam and get a sense of how large the uterus is. And so, like you said, there's so many ways to take a look at it, from an ultrasound to an MRI, for example. Um,
Okay. I see a couple comments. Let's see. Andrea Greer says she got her fibroids at 26. She's 39 now.
Mhm.
But she said after a bad car accident in 2023, the fibroids started growing fast. And now she looks like she's 8 months pregnant. I can relate. And Isaac Woolridge says fibroid surgery and it went away. Isn't that part of menopause? No, that's I don't think that's part of. No, that's. We'll get to that, Isaac. We'll explain how that works. So what happens if you find out you have fibroids and you decide, or your doctor just says, which let's do nothing, let's just leave it alone. What if they are left untreated?
So that's actually my pet peeve, and that's why I'm very passionate about all of
Mhm.
this. I feel like there's many gaps in on the patient side and on physician side regarding this topic, because that is the most commonly phrased things regarding fibroids is like what you just said. Let's leave it alone and let's see what
Yeah.
happens. And then let's do a hysterectomy. Do you see how like doing nothing leads to a hysterectomy? You
Hmm.
put
Oh
both of them
yes.
together. So what happens in between?
Hmm.
So that's kind of, why I'm passionate about what I'm doing. So I think what's really important as a patient is that you prioritize what you want, right?
Yeah.
And so for me, I usually ask, what are your fertility desires? And then we work backwards, right?
Hmm.
So understand what your fertility desires are, because sometimes managing that may not help your symptoms. For example, if you want to get pregnant, then putting you on birth control is not necessarily the best thing for me to do, right?
Hmm.
So understanding that, and then understanding your quality of life, like how
Yeah.
badly is this affecting your
Hmm.
life? Is it a situation where you're having issues with sexual relations? Is it an
Hmm.
issue where you can't even go to work, right? Or even travel? So those are kind of the perspectives that I have people start off with and
Hmm.
then work backwards. And like I said, there's no like set in stone guidelines, but you can request an ultrasound from your providers. You can
Wow.
simply walk in and say, I want.
I did not know that.
Oh,
I,
really?
I did not, because now I'm like, if I could turn the hands of time back, I would have. When she said, "Let's wait and see," I would have said, "I want an ultrasound." But instead, I decided just to go get a second opinion.
Which I
And they
love too.
didn't. But I waited. But I waited, and had I just gone sooner, we may not have gotten to where we went. So it could have, if I had known this. And I hope this is helping somebody, because I didn't know you could just walk in and say, "I want an ultrasound." Thank you for that, because I think none of us, maybe a lot of us, didn't know that.
Yeah.
Yeah. Oh, I see in the comments that Kimberly Anderson says her doctor said the same thing. If they're not bothering you, let's wait and see. And
Yeah.
let's see.
And
Go ahead. Yeah, I see a couple comments that say that. Wanda West says that too. Um, wow. Yeah. And again, it blows my mind that gynecologists will say, let's wait and see, especially after you say you've done your exam, done some labs. And I don't know if anybody else had this experience. Your iron is super low from the heavy bleeding, and it's still wait and see. So um, now, let's talk about treatment options, because I do see a couple questions about that in the comments, but I want to talk about some treatment options. Let's say we've gone through the ultrasound. Are there, at any point, do you do an MRI? And I don't know if we should talk about the different types of ultrasounds, because I think I was not prepared for one of those
mhm,
ultrasounds. I was like, what is happening?
mhm, mhm, mhm. Yeah, so at baseline, an ultrasound that is transvaginal is a great option. And
Hmm.
sometimes they may have to also do a pelvic ultrasound where the probe is also on top of your belly, kind of like when you're doing an
Yeah.
ultrasound for a baby.
Hmm.
Um, Depending on what or how large it is, the next step could potentially be an MRI. Um, and that may be because of pre-surgical planning, for example.
Hmm.
And sometimes what patients should understand is when we look at your belly and we see something large, we can't always assume it's a fibroid because it could
Yeah.
also be your ovary, right? It could be other
Mm.
stuff going on.
Okay.
So yeah, so it's very easy to say, oh, that's just the large. It may not be. So it behooves us to also take a look with an MRI if you need to.
Hmm.
And when you're, and the reason why I say that is because you mentioned treatment options.
Hmm.
So because we went from everybody's a common saying being let's watch and wait to boom, all of a
Yeah.
sudden hysterectomy. What happened to
Hmm.
the in between, right?
Right.
So I do believe that there needs to be more of a conversations about minimally invasive options.
Hmm.
And one of them that does utilize an MRI beforehand is something called a uterine fibroid embolization.
Hmm.
And I remember when I started in the location where I'm at, not many people knew what I was talking about. I
Wow.
was actually quite shocked, and I actually give kudos to my one of my mentors in training and residency, Dr. Joycelyn Greeley, for really instilling the professional passion about fibroids. So
Hmm.
in residencies, when I learned about the importance of giving other options, and I just realized that doesn't necessarily play out in real life practice.
Hmm.
So yeah. So treatment options are a lot, but sometimes it also depends on, unfortunately, if I can be as bold as to say, the interest level of your provider.
Yes.
Okay.
I'm
I'm
just
gonna be
like,
honest. I'm
yes,
just
yes. That makes sense because when I went to get my second opinion, this man was like, let's do the ultrasound or the MRI. He went straight to the MRI. And I was like, whose stuff is that? Like, and there was so many fibroids because she wanted to wait and see. So when I got the second opinion and the MRI, it, it was like I just was blown away. And he was showing me things that just we couldn't have seen, we couldn't have known just from pressing on my stomach or doing the pelvic exam or her looking.
hmm
And so, I'm a huge advocate for a second opinion if that doctor is not interested in what you are inquiring about, asking about. Um, let's see. Someone, Bridget Inman says, what is the size of a fibroid that causes you to be concerned, and when it's time for it to be removed?
That's a great question, Bridget. I think it depends on a lot because you can also which is a lot of questions actually. I'm sorry. So you could remove even something as small as 1 centimeter, right? Because is this 1 centimeter fibroid in a location affecting your fertility?
Hmm.
So remember when I talked about, well, what are the perspectives to take a look at the issue of fibroids? Is it a fertility issue? Is it a quality of life issue? Is it, so many different things. So I would say, depending on what is most important to you at that time, then address it. But yeah, something as small as 1 centimeter can come out
Okay.
if it's
So
causing
going
an issue. Hmm
So going back to the treatment options, so we talked about once the ultrasound, the an MRI, the embolization. What other options are there? I mean, I had a myomectomy, and I don't know if everybody's aware of what that is. If you can explain that, and what are there other options? Because I remember being handed a bunch of pamphlets, and I was like, I don't know what any of this means.
That's great. We're good for giving patients pamphlets. I know that. Yes. So yeah, so you have a myomectomy, like you said,
Hmm.
and that simply is just removing the fibroids,
Hmm.
just going in and taking out the fibroids. That is not a full hysterectomy, and that can be done through robotically with tiny little incisions. That can be done, through a big abdominal incision like a C-section.
Yeah.
That could be done hysteroscopically with a camera going straight through the cervix.
Hmm.
The Regardless of the route, the main thing is removing fibroids preserve your fertility.
Hmm.
Okay.
Yeah.
And then depending on the route, that can affect the way you would have a baby. Right.
Hmm.
Because if they remove the fibroids, they have to really cut deep, deep, deep into your uterus.
Hmm.
You may not be able to have a vaginal delivery in the future. You may have to have a C-section.
Yeah.
So a myomectomy deserves a thorough conversation, right, about the route and the future of what it means to have a baby. Because again, the point is to preserve your fertility, right?
Hmm.
Then there is the uterine fibroid embolization, which I mentioned, which is done actually not by your OB-GYN. That is done with interventional radiology. So that is
Okay.
actually typically a referral process. So that's one thing that should be noted. The other one, which I love, is called Acessa, Acessa.
Hmm.
So basically, what the physician will do is an ultrasound during surgery, so we can go to each fibroid and essentially shrink them. And during surgery, you can actually literally see the fibroids shrink. And they continue to shrink over a couple of months.
Hmm.
So that particular option, I'm the only one still doing it at my hospital site right now, but
Hmm.
I think is something that you should be counseled about, right? You should be
Yeah.
counseled about some of these other options.
Hmm.
So so surgical options, obviously myomectomy, removing the fibroids,
Yeah.
assess a procedure, uterine fibroid embolization, doing a hysterectomy are
Hmm.
some of the more common surgical options. And there's a whole gamut of medications as well. Um, but
Wait, medications. Nobody told me anything about medications. We'll talk. Medications.
yeah, there's medications to shrink fibroids too. Well, there's one medication to shrink a fibroid. But you have to be the right person for it. So right now there's this whole conversation about menopausal revolution, right?
Yeah.
Which I understand. Menopause is a naturally occurring transition for all women, right? Your estrogen levels go down, right? All women are
Hmm.
going to go through that at some point. But
Yeah.
not all women are going to have fibroids. And so what happens is there's the hormone imbalance where your estrogen levels can go up,
Hmm.
right? And so one of the things about the hormone, or not the hormone, the medication that can shrink the fibroid, is what it does is it essentially makes you menopausal. I'm
Oh.
oversimplifying it, but it shuts down your hormones. I'm really oversimplifying this.
Okay.
So you actually can feel menopausal, right? And so your fibroids can shrink, but it's only temporarily.
Okay.
So that's
Okay.
why I said it's for the right candidate, the right person. And so anything that's like taking out a fibroid or shrinking a fibroid typically is to preserve your fertility, because there's
Hmm.
no point in necessarily, well, let me take that back. The majority of time the physician is thinking is to preserve your fertility so you can go ahead and have a baby and
Hmm.
conceive and things like that. But I also understand, women may want to preserve just having their uterus, and not it's not even a fertility issue. It's just
Yeah.
I don't want a hysterectomy. Yeah.
Hmm. Yeah. I did see a question. Kimberly Anderson says, "What is the likelihood or percentage that they return, and how aggressive?" Kimberly, they mine returned, but I don't think she got them all out either when I had my myomectomy.
So thank you for that question. One of the things I forgot to mention is, let's think about how did fibroids get here in the first place. I think we had started that conversation,
Yes, yes,
right?
yes. Let's talk about that.
Yeah. So fibroids, event essentially we're taught we don't know where they came
Mhm.
from and why they're here. We know it affects Black women a lot. There's some genetic predisposition. You got to think about how much estrogen in your environment you're exposed to. You know, one of the things that I feel, and this is my personal principle. This is actually why I wrote this book. Is when we think about things in medicine, right? Diabetes. What's the first thing we do? Let me cut out my sugar.
Yep.
Hypertension. What's the first thing we do? Let me cut
Cut
out
out.
my salts,
Yeah.
right? Heaven forbid somebody's diagnosed with cancer. What's the first thing we do? Let me revamp my life. I mean,
Hmm.
soul, deep. When a woman is diagnosed with a fibroid, I believe there needs to be an assessment of your life that includes some level of detox, whether it's mindsets,
Hmm.
your, forgiveness, bitterness, your emotional health, your triggers,
Ooh.
and then stress, whether that's workplace stress or any other type of stress. And then you got to lose weight, right? So I don't think people
Mhm.
understand being overweight. The estrogen levels in I'm oversimplifying this, are
Okay.
higher, right? So weight loss, diet and exercise, a
Hmm.
holistic perspective of just, being the best, healthiest version of yourself, I think is really important. So that's actually what I encourage my patients to do. And then the other thing is, I don't know if people know this, but vitamin D is known to shrink fibroids.
What?
You
Wow.
did for
You
real?
are teaching tonight. What?
That's my point. Like this is yeah. So vitamin, and again, I'm oversimplifying it, but there's literally science behind it to show that it helps. And so a
Mhm,
lot of times you'll not only find that women are iron deficient, anemic, but if you were to take a whole bunch of women and do a vitamin D level check, a lot of them are vitamin D deficient. So I usually say, I joke and I say, get some vitamin D and go to, lay up on the beach somewhere, get the sun,
mhm.
right?
Yeah. And de-stress.
And de-stress. Yes.
Yeah. So my question to the losing weight aspect of it, because when you have fibroids, you're clearly your belly's getting bigger. It's harder to get that weight off. So what do you do in that case? Because it is very difficult. Like I remember going to the gym um, and seeing nothing happen because it's like, okay, that it's not getting smaller because, well, at the time I didn't know it was fibroids. But in that case, what do we do then?
I mean, there are situations where a hysterectomy is warranted. I'm not going to sugarcoat. Yeah,
Yeah,
there are
yeah.
situations where if it's, this large or this many,
Hmm.
the, holistic route may no longer be the priority. It should be a habit you develop, but at that point, if you're, requiring, blood transfusions, you're passing out, all these different things,
Hmm.
then yes, a hysterectomy definitely is warranted. But in situations where you feel like the bulk of the fibroid is causing an issue,
Hmm.
diet and exercise, then you really got to really delve into cleaner eating.
Yeah, I do remember when the doctor told me the fibroids are back. I went home and threw everything out. I mean everything, sugar, dairy, all of it in the trash because I was
Hmm.
like, I don't want to go through this again. I
Again.
got to get it together.
Again. But stress, I think and I don't even know if there's a study out there. I need to look to see, the rate of growth of fibroids. Like, can we correlate that to the cortisol level, the stress
Mm,
levels in Black women? I know that was a
mhm.
question about the rate of, and
Yeah,
there's no perfect answer as far as the rate of like growth and return. Is You're gonna have all these wide range of statistics, but um I do believe that we underestimate the effect that stress has on our bodies as women and your reproductive health.
yeah. I'm curious, and I don't know. This is coming from another podcast that I did on my other podcast, Ladies Edition podcast. But we had a woman come on the show. She was from London, and she talked about how sometimes she believed that fibroids came from us holding on to trauma. And you mentioned some emotions like being bitter and all that stuff. And so she said she shrank hers by just really working on letting go of those emotions, letting go of that trauma, working through who she was mad at, who she was bitter at, mad at herself, worked all that out. And when she went maybe the next year to get an ultrasound, it had shrunk. And so I was like, really? Now, is that a thing you think? Because when I look back at when my fibroids appeared, each time there was somebody getting on my nerves, but it was something going on during those times. And so there was that, it was emotional.
You articulated this better than I could, and that's why I created my Mayo Imani platform,
Hmm.
which is to tie in that missing piece in medicine. We talk about the mind, the body, but there's also the soul and spirit aspect of it, right? You
Yeah.
can't deny that, but that's true. And it's actually, it's not in front of me, but I have this huge book, this thick book. It's called, I think, Be in Excellence or Be in Good Health.
Hmm.
It has literally, it goes through each of the body systems and it correlates disease to emotional health. So, like tumors, breast cancers, a lot of these things are linked in unforgiveness and bitterness,
Hmm.
right? And then
Oh,
it
wow.
goes on to like, okay, for example, when somebody is anxious, right? How does that present in your body? Chest pain,
Yeah.
diarrhea, sweaty, like you're not having a heart attack. There's nothing wrong with your heart, but
Hmm.
that emotional duress shows up in your body, right?
Right.
So what
Yeah.
you just said is I 100% believe in that. And as a woman of faith, even the scriptures even talk about being in good health, right?
Hmm.
So your body can prosper. So I do think that when we're thinking about stress management, it's not just about the routines of going to get your hair and nails done, but literally, are you able to walk in life with a sense of peace? Like, I don't play with my peace.
Same.
With a sense of peace. But yeah, thank you for that comment.
Yeah, Kimberly Anderson is asking, so dairy products like whole milk, chocolate, all those things, does that contribute to fibroids?
That is a risk factor.
Hmm.
And part of it you have to think about is what are um again, some of the foods that we're eating are have excess hormones injected into it, right?
Hmm.
So you can't ignore dairy is part of that. Yeah.
Okay.
So that is listed as a risk factor um, for fibroids.
Yeah, I that was another one I cut out immediately. And then as soon as I had my surgery, I was like, geez, here I come. But I have since broke up with it again.
Mm-hmm. Mm-hmm. Mm-hmm.
Now, can you talk about the minimally invasive procedure that you do?
Yeah. So the procedure that I do is the Assessa procedure.
Hmm.
And I did two this past week actually.
Okay.
So I've been the only one doing it at my hospital for about 3 years actually. Which I have I it kind of bothers me if I could be honest.
Yeah.
That we have so much technology out there. For example, the Da Vinci, the robot, to be trained to do this.
Hmm.
And, I'm trained to do that, and a lot of physicians are, but I feel as though we all should be equally trained in certain technologies so that we can all offer, you know, women access. So, but it's okay. And sometimes you may just be that referral provider
Hmm.
for it, and that's
Right.
okay as well. So that procedure I love because you're able to send the patient home the same day. So you're not having to stay in the hospital,
Hmm.
right? There's very minimal incisions on your abdomen. You literally get the gratification of seeing in real time the fibroids shrink, right? And get
Wow.
softer. Yeah. So it goes from something as hard as like a baseball to like a marshmallow, right?
Mm.
Yeah, yeah. And so I typically will see you, the routine post-op time, make sure everything is okay. Then I'll do another ultrasound in like 3 months and then 6 months. And we literally see the volume shrinking of the uterus and the fibroids in real time.
Does
So
it how far does it shrink? Like, is it about 50%? I think that's what my doctor had mentioned, but it was like, but you're not a candidate anyway. But he was telling me about it, but it was
it can. Yes, it
okay.
definitely can
Okay.
shrink up to 50% for sure.
Okay.
For sure. But
Okay.
then but I think like we mentioned about stress management, emotional healing, like
Hmm.
then that's the time to do all of that, and not do
Yeah.
these type of minimally invasive stuff and not change your lifestyle.
Right. Right. Anisha Seabrook wants to know, is there a correlation between hair relaxers and fibroids?
There's a correlation between a lot of reproductive health issues and hair products.
Okay.
Yeah.
Is it just mostly black hair products?
Well, I mean, can I be real with you guys? I don't know how real I can
Please,
be.
please, yeah. Be real. Be real. Tell us.
I don't know how many people wear weave. And have you ever
Mhm.
gotten a bundle and smelled it and you're like, this doesn't
Yeah. I
that's
know my scalp
chemicals.
didn't like it.
Right. Those are
Yeah.
chemicals. Right.
Mhm.
And so but it's not a situation where it's just one like it's a store full of stuff like that.
Yeah.
So I think we have to be very cautious right? About what we put in our mouths and in our bodies and around our bodies as
Mhm.
well. But I also do believe in in addition to that, because even that, I don't want that to be stressful where you're like, oh my God, I can't use this, I can't use this. But just having
Yeah.
a routine, regular regimen of some type of detox. And what does that look like?
Hmm.
Sweat. You got to work out, right? Letting all that stuff come out through your pores,
Hmm.
drinking lots of water,
Yes.
right? Having regular bowel movements so that waste isn't just like stuck in your body,
Hmm.
you know? Some people I do believe in herbal teas, right? To help with that. Your liver is a major organ that helps regulate the estrogens in your body. So
Hmm.
making sure you have good liver health are some of the things that you can look into.
Is there a specific tea? We did a show on herbal
Oh,
teas a few weeks
okay.
ago, but is there?
Okay.
I can't remember which one was the one for fibroids. We did talk about reproductive health. Maybe we didn't zero in on fibroids, but is there one that you recommend?
Dandelion tea.
I had that too. It's not bad, y'all. It took me a little bit to get used to it, but it's not bad.
It's not bad. They have like a regular dandelion tea, then they have a roasted dandelion tea, which tastes like coffee to me. But
Yeah. So what would you say are the pros and cons of if it gets to the point where someone needs a hysterectomy, or is there a pro and con really? Um, but before, if the doctor says it's time for you to do the hysterectomy, what should women know before agreeing to it?
Oh, that's a great question. I think, part of it is an informed consent process. So I think
Hmm.
you should, expect to have a conversation about, recovery. I expect to have a conversation about what they're going to do with your ovaries, if they're going to take them out, leave them, because sometimes what you don't know what you will get into till you actually get into the abdomen.
Yeah.
There should be a conversation about sexual health as well, because there's lots of misconceptions. There should be a conversation about, did you not necessarily exhaust, but are you aware of all your other options? And
Right.
are you sure that you don't want them?
Hmm.
Right?
Yeah.
Versus a conversation where, well, my grandma, everybody in my family, I hear that all the time. My grandma, everybody in my family had a hysterectomy, so I guess I'm going to have a hysterectomy too. Oh,
What?
yeah, I get that a lot. I get
Wow.
that a lot. So that okay, am I do I understand my current situation, and do I understand all my options? Are the things that I think you should definitely have before deciding for a hysterectomy. And but and sometimes, like I said, there are situations where the hysterectomy is the best option for you,
Yeah. Hmm.
and sometimes it's a situation where you may just kind of be belaboring it. So like what the research says, from the time a woman is diagnosed from a fibroid, it may take them 3 to 4 years before they make a decision for treatment.
Yeah. Hmm. Hmm.
you know
Yeah. Yeah. I held off as long as I could before I decided, let me just go on and do this hysterectomy, because I mean I was at an age where I'm like, ain't no kids happening anyway, so let me just go on and do it. But we exhausted every single option by that point, and he said you've done all you can do. And he
mm,
also said, and I was going to ask about this, when that hysterectomy conversation came up, he said, do you want kids? And I was like, I don't know. At this grown age, I don't know. And he said, well, you can still retrieve those eggs. We left my ovaries. So he said, you can still retrieve the eggs and save them if that's what you choose to do. And that for me was like, okay, now that I know that, let's go.
you know what, that brings up even a more I'm not a fertility doctor, but
Yeah.
there is even health inequities even in that space with Black
Yeah.
women. And that brings up a great point, which is the conversation of egg freezing, if that
Hmm.
needs to be had. You see how that really encouraged you to make the next step.
It did.
Yeah.
It did. Yeah. Yeah, because otherwise I was like, well, blah, 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 blah. I mean, this that poor man. Every single time I had a question, he sat on like the Zoom and talked to me until I was. So I think y'all got to find a doctor like that. He did not push. He was like, "You let me know when you ready." Like we tried everything. So yeah. What is one? misconception about fibroid treatment that frustrates you more than any single thing? I mean, I know you talked about a couple frustrations, but what's the number one thing?
That you can't get pregnant.
Mm-hmm. Yeah.
Um, and that is because I've seen it all.
Mm-hmm.
And again, I think part of it also comes from me just being a woman of faith, knowing that, God has the final say. So usually when I have people in my office and I am like, I see your age, I see this, but I've seen a lot. But I also believe faith without works is dead, right? So if we're doing nothing over here, so
Mm-hmm.
I think that's my biggest pet peeve is when you're labeled or you're given a diagnosis and you feel defeated without even trying or having a conversation.
Mm-hmm. Yeah. Well, how can women advocate for themselves when they feel like their doctor is dismissing them, or the thing we talked about earlier, like the let's wait and see, or they feel pressured into jumping from you have fibroids, oh, let's do a hysterectomy, and nothing else has been, they haven't tried anything else yet, but they're feeling pressured. What can you say to these women?
Three simple things. Why should be very you should ask why a lot in your conversations. Why should be a very popular
Mm-hmm.
letter or word in your conversations.
Mm-hmm.
And then similar to what you said, second opinions. There's no harm with second opinions. I'm a firm believer in that. And if you get the same opinion over and over again, then it's probably, sound medical advice.
Yeah.
So I do believe why, asking why, and then also definitely the medical opinions. And then this is just again a Dr. Faith principle. I like to treat, my patients as if they're family, right? So I
Mm-hmm.
feel like there's some level of if you can you have some type of connection, you can relate to somebody as a human or as a friend or something. You tend to you treat them nicer, right? For
Mm-hmm.
example, so you can ask your physician, what would you do, or what if I was your sister, what would you do? So it's
Ooh,
kind
that's a
of
good one.
putting the accountability back on them because um that's important. So you also can definitely, come into the appointment with preset questions.
Mm-hmm.
You can also have a follow. I do virtual follow-ups all the time because what happens is you'll get all this information in this amount of time to synthesize everything, and I don't
Yeah.
expect you to make a decision. So it's
Mm-hmm.
very okay to say thank you for this visit. Can I follow up? Do your due diligence, talk to friends, family, and then circle back with a conversation or a list of specific questions.
I like that. You guys, we got like a few more minutes. If you have questions, please hurry and drop them in the chat. How can this question has been one that I've thought about a lot, and we talked about it on my podcast as well. How can women's partners and family be supportive when they're dealing with fibroids? I had a whole rant. I don't know if you saw it, but I had a whole rant. I think I posted it last week about when some people can't see what we're dealing with internally. They want to have make these comments of, "Oh, you getting big, aren't you?" All that you pregnant, like all these assumptions and things about you gaining weight and not realizing it's fibroids or something else. So how can just people in general, whether it's a partner, family, friends, how can people be more supportive to someone dealing with fibroids?
Um, I actually have like a little Instagram post about like never ask a woman if she's pregnant because you never know what's in there. You just
Right.
never know. So I think families can be supportive by simply just asking about your general well-being.
Mm-hmm.
And then it's going to be up to you how much you want to share or disclose.
Yeah.
That's what I think. In general, how are you feeling? How are you doing? Are you
Mm-hmm.
stressed? That kind of
Mm-hmm.
conversation.
Okay. All right. Well, um, I want you to give everybody a reminder one more time about the importance of self care, because I don't think they don't hear enough. Just please explain why self care is so important, especially when you're dealing with fibroids or trying to prevent them growing.
So Self-care is important and is beyond just doing your nails and makeup,
Mhm.
right? It's a matter of making sure that you are intentionally living out the best version of yourself, because you got too much purpose. You were designed for too much to be, not taking care of yourself and your vessel. So self-care is definitely something that should be prioritized. And I think you're right. As women, we have to be reminded of that a lot, a
Yes.
lot.
Yes. And rest, 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 rest. I always am talking about rest. I need to do it myself. Rest, y'all.
And set boundaries. No has been my favorite word lately.
Yes, that's a big one. Set boundaries. Well, Dr. Faith, this has been a great conversation. I think
Thank you for
the
having me.
comments have been lit tonight. But for my last question, what feeds your soul?
Oh, what feeds my soul?
Hmm.
I would say knowing, how do I say? So, if you've ever gone through stuff in life and realized that you are still standing, that's what feeds my soul. Meaning, wow, God really has you here for a reason, for it, and for a purpose.
Hmm.
Execute that and execute that with excellence. So that's what feeds
Ooh.
my soul. Knowing being purpose driven is extremely important to me.
Hmm.
I love Miles Monroe, so I listen to a lot of his messages. So I think what feeds my soul is knowing that I am living on purpose, in purpose.
Hmm. Yeah. Oh, we have one more quick question.
Oh,
That's a great answer. I want to make sure we answer this before we go.
sure.
Loretta
Yeah.
Thomas just asked, "What is the difference between a fibroid and a cyst?"
You know what? Thank you so much for asking that question, because I get it's confusion all the time. So a fibroid is a tumor that's solid, typically, right? Like a cauliflower and a broccoli, like I mentioned. A
Hmm.
cyst is fluid filled. So a cyst is like a balloon full of water. So two
Hmm.
different structures. That's a
Hmm.
great question.
Yeah, that is a great question. I didn't even think about that. Thank you, Loretta, for
Hmm.
that question.
Yeah, yeah.
Yeah. Dr. Faith, this has been such a great conversation. I'm so glad
Yes.
that we could kick off Fibroid Awareness Month with this conversation here on Soulibration. How can people find you on social media? Because I'm sure they want to see that post that you were mentioned a minute ago about don't ask me. Because I'm going to look.
Yeah, no. So I have two Instagrams accounts. You can find me at I am Dr. Faith .md. And then I have the fibroid specific platform, which is at Mayo Imani, um,
Mhm.
as well. And I am on YouTube if you want to follow me at Dr. Faith MD.
Okay, perfect. And you guys see how to spell it right there under her name. It's right there. Thank you so much,
Thank
Dr. Faith, for
you.
joining me tonight. I'm going to be like, can you come back and talk about this or this or
No
this? So,
worries. No worries. No worries. Awesome.
well,
Thank you so much.
yeah, thank you. For more information, everyone, on fibroids and everything we talked about tonight, you can also head over to blackdoctor.org. There's articles and resources there. And I hope everyone has a soul filled rest of the week. Thank you again for joining me.
Thank you.
Thank you. Good night, everyone.